Hello, my name is Miguel Crато. I am the president of the European Hemophilia Consortium, and I'm myself a patient with hemophilia A severe with inhibitors. We work at different levels. First of all, we recognize that there are a huge disparity in terms of care and treatment all across Europe. For example, the level of care that we have in Western Europe, it's totally different from the level of care we have in Eastern countries, in other countries. So our main objective as an umbrella organization that conglomerates 48 countries and 48 associations, it's to try to reduce the inequalities that exist in Europe. So, point number one, try to give principles of care, try to give guidelines, support our NMOs and give them orientations and be always with them in advocacy in their countries. The roles of patients, organizations and medical societies or doctors are crucial, and they need to collaborate very actively. They are the main stakeholders, the main actors of bleeding disorders. Doctors as prescribers and patients as receivers. So they need to work together to achieve a common goal of knowledge and try to reduce the level of analphabetism from patients. It's very important to assure that they establish a shared decision-making process. So anytime a doctor needs to prescribe some drug related with bleeding disorders to a patient, they need to have a conversation with the patient and share the decision of doing that treatment with him. Obviously, this is a very difficult process in some countries, so it's important that the NMO in the beginning have always good relations with doctors in their countries. It's important to call them to the association, call them for example for a scientific committee. It's very important to have a scientific committee. It's very important for each NMO to organize events in their countries when they have the patients and the doctors in the same room. It's super crucial, so the doctors can learn from the patients, because the patients have a different perspective of the disease, and the patients can learn in scientific terms from the doctors. I'm always advocating that patients need to know more about their condition, and that's the only way they can reach autonomy and improve their quality of life.
Здравейте, казвам се Атанас Банчев и съм ръководител на експертния център за хемофилия и таласемия в университетската болница ИСУЛ в София. Всъщност през последните 10 до 15 години се наблюдава наистина за нас мечтан назад във времето напредък по отношение на грижите за хората с хемофилия и особено за грижите за децата и младите възрастни. Всъщност това, което беше въведено преди 15 години, профилактиката, ранната профилактика от най-ранна детска възраст, днес виждаме, че е довело до съществено подобрение на качеството на живот на цялата тази група от хора, които живеят с хемофилия. Всъщност, ако днес видите един човек с хемофилия на улицата, ще забележите, че той по абсолютно нищо не се различава от един човек, който няма хемофилия. Спортуват активно, абсолютно ефективна част на обществото са и това е нещо, с което най-много се гордеем. Ранната диагностика на ставните усложнения е особено важна от гледна точка на това, че на този етап ни се иска да вярваме, че пациентите с хемофилия не би трябвало никога през живота си да получават ставен кръвоизлив. Защото ако такъв настъпи в ранна детска възраст и той не е правилно лекуван, съответно не е правилно диагностициран, в относително ранна късна възраст, да кажем около 30 години, човека с хемофилия може да има тежки нарушения, да кажем, на походката си, което да се отразява на качеството на живота. От тази гледна точка, ранната диагностика не на болестта хемофилия, а на ставните усложнения е от изключителна важност.
My name is Paul McLaughlin. I'm a specialist physio in haemophilia and I work at the Royal Free in London. Physiotherapy is important for long-term health and well-being for people with hemophilia because we look at joint health, we look at joint pain and managing a life with joint damage and arthropathy. But I think with the sort of combined ages of people that we're now with children on new therapies and prophylaxis, it's about making sure that they are able to be fit and well to do the activities they want and to be able to participate with their peers and friends. And for those older men with haemophilia, the physiotherapy can help them sort of to improve their function and participation in society, particularly around management of painful joint arthropathy and mobility problems. The latest advancements for haemophilia physiotherapy are quite a lot. I think for the younger people with no joint disease, there is lots of work being done on how we can do better assessments of physical wellness and physical activity. And I think for those living with arthropathy, there is lots of work being done currently at the use of exercise, both in person with physiotherapy, but also the use of digital health technology. So being able to do rehabilitation through digital tele-rehabilitation and telehealth. And I think that's a very exciting prospect because it actually means that for many people that have to travel a long distance to see a physiotherapist, that being able to use technology to have expert physiotherapy and sort of exercise intervention can be really helpful for people.
Hello, I'm Evelyn Grimberg from the Netherlands. I have a bleeding disorder myself. I have the rare bleeding disorder Glanzmann thrombasthenia, which is a platelet disorder. And as a woman with a bleeding disorder, I've been active as a volunteer for almost 20 years in our national organization, but also at the EHC. I've been part of the Women and Bleeding Disorder Committee, but also at the Airing Committee, and I've been to the steering committee for 2 years. Well, women with bleeding disorders like hemophilia and von Willebrand deal with issues in getting to treatment. Not for all bleeding disorder there are treatment available, but they also experience a delay in getting a diagnosis. So they experience bleeding like nosebleeds, troubles with the gum, bruising, and their heavy period is mostly a reason why they reach out to a doctor because it's too much and they are getting anemic. But to get a proper diagnosis, it takes sometimes a while. And if they have a diagnosis, getting access to care and proper treatment is also not always easy. One, it is not always available, so it's a struggle to find the right solution. And when it's available, it's not that common to get, for instance, prophylactic treatment or support in that case. So it's a lot of talking with the hematologist, but also a gynecologist to get them on board. And if they are in, you really need to work together as a team. The better support for women can help, of course, the women in general. But first, I think it's important to educate ourselves, educate women in general, what is too much, what is acceptable. And if we know that, so it's not normal to have a nosebleed for 5 hours or maybe for several days. It's not normal to have a period for 2 weeks, or it's not normal to bruise. It's different compared to a normal life. So we need to understand that we can reach out to a doctor to make it different and to express ourselves that there is something wrong. And if we got to understand that when it's normal or what is not normal, especially in a heavy period, but also express it to our doctor, I hope that the quality of life will be better. But also the society, the community is very useful to bring this support and advocate for a better care.
Brian O'Mahony, Chief Executive of the Irish Hemophilia Society, former President of the European Hemophilia Consortium and of the World Federation of Hemophilia. If we want to improve treatment for and health outcomes for people with haemophilia, it is absolutely imperative that healthcare professionals and patient organisations work together. Governments will not apply resources to haemophilia or will not prioritise haemophilia if they're not getting a consistent message from healthcare professionals and patients. So they must work together, they must agree the core objectives for treatment and for comprehensive care, they must advocate together for those to government and to payers, and then they must collaborate ideally on implementation of those recommendations in terms of comprehensive care and treatment within a country. I think if you look at communication and solidarity between patients and healthcare providers, what's really important is constant communication, is a degree of empathy from the healthcare professionals towards the patients. It's a degree of understanding from the patients and patient organisations towards the obstacles facing the healthcare professionals. And really, they must work synergistically and together. Otherwise, you do not get good outcomes. And the ideal outcome is where, for an individual patient, it's shared decision making between the clinician and the patient. Organisationally and nationally, it's shared decision making between the centres and the patient organisations to really advance care.
So first, I'm Mark Skinner. I previously served as president of the World Federation of Hemophilia, and before that, the National Hemophilia Foundation in the United States. So when you ask the question, how is data collection shaping the future of hemophilia? I think the short answer is dramatically. We have seen a robust evolution of hemophilia care over the last decade in particular. And as new therapies increasingly bring the opportunity to move closer and closer to 0 bleeds a year, other things become more important or become more relevant for those of us that live with a bleeding disorder. I live with severe hemophilia, and the kinds of things that are important to me are not just how many times did I bleed last year, but what is my ability to go to school, to get a job, to have a career, to have a family, to do the things in life that I really want to do, and to not have those limited by my hemophilia. So the ability to collect data on what the impact is on my life day to day becomes increasingly important as we build our case that we should have an equal opportunity with someone who doesn't live with a bleeding disorder in all aspects of daily living, not just being free from bleeds, but knowing that our lives really have the opportunity to be normal. So when we think about the role of data, particularly as it means achieving access to advanced therapies, we know that governments have to make decisions about where they're going to allocate limited government resources, what they're going to spend on health care. And so understanding the value of the treatment really is important to governments. And so as a patient community, when we can collect and contribute data showing that the impact of a treatment has on our lives, to be productive citizens, to contribute to society, to really be able to give back, is fundamentally important. And so that cost equation of the benefit and the value becomes an important consideration. And so I think we've learned over recent years that if we have better data, then we're going to be better advocates. So better data leads to better advocacy, and better advocacy then leads to better outcomes. And so it really is that full cycle, but it begins with the patient. It's the patient reporting the data, reporting the impacts, the ability for the society here in Bulgaria to be able to aggregate that data to tell the whole story. We're increasingly moving from telling the personal anecdote, and that's certainly important to tell your personal story, but then for me to be able to go on and say, my personal story is the same as 75% of the other people living with severe hemophilia in this country, that becomes powerful. And then when we can demonstrate that when you have access to treatment, those percentages change, or we're changing the long-term outcomes, then that really is value. Value is more than just the cost of the therapy. The value is what it brings to the quality of life for those of us living with it.
Здравейте, казвам се Димитър Петров и съм председател на младежката група на Българската асоциация по хемофилия. Профилактиката има много важна роля в живота на един хемофилик, независимо дали е младеж или вече възрастен човек. Благодарение на профилактиката ние може да изпълняваме ежедневните си нужди, да ходим на работа, на училище, да излизаме навън приятели, да ходим на разходки по планините, да спортуваме, като цяло да водим съвсем нормален начин на живот, без да се ограничаваме вече какво може да правим или не. Благодарение на профилактиката в юношеските си години започнах да спортувам, да ходя на фитнес, нещо, което допреди това беше малко тема табу. Но точно заради профилактиката аз започнах да тренирам, да ходя на плуване, да карам колело, което до голяма степен също подпомага за здравето на ставите и на мускулите.
And I would like to give a positive message to the Bulgarian Hemophilia Association and congratulate you for the excellent work you've been doing for all patients with bleeding disorders.